Hello, I'm Pam, and I'll be answering your questions on America's Choice Plans. But first, a little info on America's Choice Health Plans. America's Choice was created to offer your clients more options for healthcare insurance, especially when they need a PPO and there's no special enrollment period available. Plus, starting in late 2024, short-term policies will be limited to just 3 months. Let's be clear, this plan isn't for everyone. However, it can be a fantastic option for those who aren't in a special enrollment period, need something permanent, or just need coverage until open enrollment. It's not just a placeholder, it's a real solution. These policies are often more affordable than exchange plans, particularly for families who don't qualify for a subsidy. They're fully insured and not indemnity plans. Our team of over 1,000 agents have 14 years of experience selling very high-end indemnity plans. We've found that none of our clients have used more than $240,000 in benefits in a calendar year. So, a $500,000 or $1 million policy is more than enough insurance to get your client through a calendar year. America Choice's metal plans use the Blue Cross Blue Shield network of Nebraska, are marketed under the name of Gig Care, and have no annual limits. All our policies are PPO plans and compete with ACA policies on costs and coverage. Now, here are some of the most frequently asked questions from agents just starting with America's Choice. Monica wants to know.
Pam, it's my understanding that America's Choice plans fall under ERISA. What's a ERISA plan?
Monica, an ERISA plan is a program fund or plan created or maintained by an employer to cover employee benefits, such as health insurance, retirement accounts, or other benefits. ERISA stands for the Employee Retirement Income Security Act, a federal law passed in 1974 to protect employee pension and health plans from fraud and mismanagement. ERISA applies to all private employers and employee organizations that offer health plans to employees, except for churches, government groups, and individual plans such as those on the exchange. Many companies with 50 or more employees use ERISA plans to insure their employees. You may know these plans as level-funded or self-insured plans. This is why, as an agent, you can sign clients year-round, not just during open enrollment.
Well, since this is an ERISA plan, do our clients need a qualified life event to change their enrollment, like adding a family member to the policy later in the year?
Yes, Monica, whenever there's a change to their plan, like adding a new family member, they will need a qualified life event form completed. They'll also need to provide supporting documents like birth or wedding certificates. For removing a dependent, they'll still need to fill out a QLE form, but no extra documentation is required.
Hi, I'm John from Virginia, and I want to know, Pam, when is pre-authorization from the America's Choice needed, and how does a policyholder get it? Is it required for hospital visits, surgeries, or emergency room visits?
Good question, John. Pre-authorization is necessary for certain planned medical services like MRIs, CT scans, surgeries, and durable medical equipment. This is a common requirement for most major medical policies. There's a specific form for this, and America's Choice's advocacy department is here to help. However, emergency room visits are covered under the plan's emergency room benefits, and routine doctor's office visits, such as checkups or sicknesses, require no pre-authorization.
Hi, my name is Greg from Maine, and I'd like to know, what is reference-based pricing, and does America's Choice plans use it?
Yes, Greg. America's Choice plans use reference-based pricing, which is a cost containment strategy that uses public data as a pricing benchmark to determine a fair cost of care, instead of relying on the often inflated chargemaster prices set by hospitals or facilities. Here's how it works. Reference-based pricing providers use benchmarks like Medicare rates, customary, usual, and reasonable costs, or the actual cost reported by the facility. They then reprice the claim, adding a fair profit margin to this reference price. This new amount is what gets paid to the healthcare provider.
That's all well and nice, Pam, but what are the benefits of reference-based pricing?
America's Choice uses reference-based pricing to keep costs low. Reference-based pricing helps reduce medical costs for self-insured employers. This strategy delivers significant savings by lowering America's Choice's long-term healthcare costs, reducing out-of-pocket expenses for enrollees and their dependents, Getting these lower prices is paramount in keeping plan prices low, which is why pre-authorization before plan procedures are necessary, and why America's choice plans costs are so much less than ACA policies.
Hello, I'm Susan from Kansas. My understanding is that doctor visits, labs, and imaging are covered under the network, while hospital visits, outpatient surgery, and emergency room care fall under reference-based pricing. Is this correct? And do policyholders just show their ID card for everything?
Susan, yes, each plan has different copays, limits, deductibles, etc. You can find plan brochures on your agent website. For anything needing pre-authorization, members can call 866-815-6001 or email member services at detegohealth.com to start the process. For regular visits and medical needs, showing the member ID card, which lists the PHCS or the Blue Cross Blue Shield networks, should suffice. Emergency room visits don't need pre-authorization.
Hey, it's me, John, again, and I want to know, how does telehealth work? Is it provided by America's Choice, or is it covered if you have a virtual visit with your own provider? Or is there another way?
Well, John, telemedicine benefits are provided through MyLiveDoc. When you enroll in a plan, you'll get an email before your coverage starts with info on how to activate and use your telemedicine portal. Each dependent over 18 will have their own portal because of HIPAA regulations. Is documentation required to prove someone is eligible for insurance as a 1099 or self-employed individual? For example, if someone is getting certified as a personal trainer but won't have their certification for another 30 days. Well, Susan, this is the question we get the most of. If proof of 1099 status is requested, the member will need to provide it. During the application process, members attest and sign off, confirming they receive a 1099 at year's end. This is the first question on the signature page. They will also qualify if they hold a professional license, such as a plumber who works for a HVAC company. If a member loses their 1099 status, they'll need to find new coverage. We use the IRS definition for self-employed, which you can Google. Here are some examples of people who will qualify for an America Choice policy. Running your own business with employees, being self-employed without employees, working in the gig economy such as Uber, Lyft, Fiverr, you get the idea. Freelance consultants receiving a 1099, even if it's just part-time or once a year. Uninsured partners of Medicare recipients if their spouse receives a 1099 from investments like bank interest, annuities, etc. People who have professional licenses, such as a plumber, electrician, beautician, see what I mean. Additionally, you can sign up for Life Advantage for $50 a year and complete a W-9 to become a distributor. You, as an agent, may want to sign up for this to see how it works. Well worth your effort.
Who can an agent call if we have underwriting questions or unsure if someone qualifies? For example, someone who was on disability due to West Nile virus, but is now healed and back to work, or a baby with hip dysplasia wearing a corrective brace.
Greg, no worries. If you have underwriting questions, you may call customer service at 866-815-6001 or email agent support at checquotes.com. Clients may email support at americaschoicehealthplan.com. It's crucial to confirm that members are self-employed or receive a 1099. For the individual with West Nile virus, what type of self-employment does he have? He needs to get a 1099 at the end of the year to join an America's Choice plan. The child with hip dysplasia is fine and qualifies if he is signing up with a guardian that receives a 1099. Keep in mind that commissions are level. The commission you earn from your initial sale will remain consistent 30 months later, provided your client maintains their policy. So, get started with America's Choice plans. What a great way to write policies year-round without a special enrollment period.